All right, good afternoon. Thanks so much for being with us. I'm Cassandra Wallace with the ThedaCare Public Relations team. I'm joined by Dr. Mark Cockley, our Chief Clinical Officer, and Dr. Jennifer Frank, our Chief Medical Officer. Thank you both for being with us. We are talking COVID-19 vaccines. We wanted to take this time to give our followers here on Facebook the opportunity to ask questions that they might be wondering about the vaccine. You both will be giving us some updates. We've had some big changes in the last couple of days here, so we want to make sure that we are sharing the most accurate and up-to-date information possible when it comes to this important milestone in the pandemic. So again, thank you both for being with us. I am taking questions live, so I'll be monitoring our comments in the section here. We'll get to just as many as possible. These conversations have been wonderful. The questions coming in have been great, so keep them coming. And again, we'll get to as many as possible. And even after the event, we'll continue to monitor this feed and get to as many people as possible. So again, thank you for being with us. I want to get right down to it. Dr. Cockley, first off, can you give us a bit of an update about where we are with vaccines right now in Wisconsin and maybe across our ThedaCare system?
So thank you, Cassandra. Yes, really, I think Wisconsin overall has done a great job of getting vaccinations out. We're one of the highest in percentage of vaccines received and then administered. Looking at, the county areas where we're serving, a lot of, especially in that initial group of those 65 and older, it's 60 to 70% or more have been vaccinated, at least that first step, and about 30% have had both vaccines or higher. So really a great response with that. We're still servicing those people that are in that 1A group, high risk, anyone who in the medical community or those first line responders haven't been vaccinated because they were questioned, still available and getting those people in. Have done a good job at rolling it out now to that next step that's been out there for a couple of weeks of people that have medical conditions, and now rolling those out and trying to get it and serve all the counties that we're in. So I think we're continuing to go expand, have our capacity to be able to do, our target would be 10,000 vaccines a week and have that capability to do it. But as we get more vaccines, we'll continue to roll out more locations and more appointment slots available for vaccinating the community.
And Dr. Frank, our Chief Medical Officer. Dr. Frank, you are in clinic with patients. You're hearing what they're saying. So what has the response been so far to the vaccine process? Again, we're just sort of rolling it out to that next wave of eligible people in our state, but what are you hearing so far?
So Cassandra, I'm hearing a lot of different things, kind of what you would expect and what represents the rest of our country and kind of the dialogue we're having around vaccination. So I have some people are very eager to get them, wondering how quickly can I get it? Am I eligible? How do I get it? And I really talk to them about the process through my ThedaCare or alternatively options within our community, whether that's through the public health department or through a pharmacy. And my recommendation is to get the vaccine as quickly as they're able to. I also have a fair number of people who are either waiting to make sure that they are able to see more evidence of what the effectiveness or safety of the vaccine is, so kind of not wanting to do it just yet. And then I still have some patients who are very concerned about getting it, either from a safety standpoint, feeling that it's just very new, or in some cases not being that concerned about the effects of COVID-19. So really seeing a wide variety of different responses.
I think that's kind of that interesting shift of where we are. Demand has been so great up to this point of people wanting to get vaccinated, which is wonderful. And now we're kind of moving to where we need to present the facts and the information. And again, just talk about those reasons why it's important to get vaccinated. Dr. Cockley, can you tell us just a little bit about how the process works from a ThedaCare perspective of how many doses we are allotted from the state and federal government? Because I know that that's been a question so far. A lot of people wanted the vaccine in the beginning and the doses just weren't there across the state. And now we're kind of making that shift. So can you talk a little bit about that process so it helps people understand it better?
Yeah, it's a little bit of a confusing process, but what we've done so far is, all the doses we get in, we get out as quick as possible. And we've given out over, 43,000 doses so far since we started this. It seems like a while ago, but it was just around Christmas time. And I'm seeing a few snowflakes outside, so I don't think winter's coming back, but just kind of reminder back there. But what we do is, the process is we submit to the state of how many vaccines we want for the coming 2 weeks. And from that, they'll look at what allotment they get in from the federal government and then divide that proportionally throughout the state. And they've got a difficult job of distributing those vaccines to where it's needed. Obviously, we all want it, but trying to get an equal proportion of the high-risk people in the communities vaccinated throughout the whole state. So obviously, we would like to get more vaccine than we are, and we're getting anywhere between 1,000 and 3,000 vaccines, give or take the week over time. And we know about a week ahead of time what vaccines we're going to get. So today we just find out what we're getting for the following week. So starting next Wednesday, we can now open up those vaccine slots for the number of vaccines we're getting, because we don't want to really dissatisfy people of, hey, I've got a vaccine slot, but then get to that time and not have a vaccine for them. So we're making sure we're in there and really able to adjust on a weekly basis. A couple times we had our allotment, here's what you're getting for the next week. And the vaccines come in and say, hey, the state said we had a few extra that didn't get claimed or not. We're sending you more. And we're like, yep, whatever you want to send us, give us. And really, we have no choice in what manufacturer we get either. It's either Pfizer, Moderna, and we've received some Johnson & Johnson. The state's kind of evaluating that, and some of the Johnson & Johnson's a little bit easier to store and transport. So they may be transitioning that to some of the smaller immunization sites, which it makes it easier for them. I think the more vaccines we can get out to wherever we can get them out to vaccinate people, the better. And we just want to do our part in that process. And we're happy to get as much as the state will give us, and we'll get it out as quick as we can.
Thanks for providing that information. Just like you said, it's a bit of a confusing process for people to understand, but we're hoping that maybe makes them just see kind of what we're up against there in terms of scheduling and things like that. Again, Dr. Frank, you said that you've heard from patients who are ready to get vaccinated, looking for those appointments. So can you talk just a little bit about ThedaCare's process? We are using my ThedaCare and my chart to schedule vaccines. Can you tell us a little bit about the process? And now we've sort of moved to this direct scheduling opportunity. So just discuss that for us, please.
Sure. So we are, and as we have been all along, we are abiding by the Centers for Disease Control recommendations. One of their recommendations is to make sure that we are screening people before they get the vaccine so that they're safe, that there are no risk factors for them, that there are no reasons they shouldn't get it, or that we should delay immunization. So those questions are part of what we ask through the MyChart process to make sure that we are not scheduling someone for an appointment and then they get there and they can't get the vaccine. So that is part of the process, is answering those questions. And that will be questions like, are you pregnant? Are you breastfeeding? Have you had COVID? Have you recently had a vaccine? Those kinds of things. Previously, you needed almost like an invitation to schedule, meaning that we would send you an invitation and say, hey, you are now eligible to get vaccinated. We are now moving to a direct scheduling process. So it mimics our direct scheduling for things like mammograms, labs, office visits, and now for vaccination. So if you are eligible to get a vaccination, you can go onto your MyChart account and do a direct schedule appointment so that you schedule yourself for an appointment. And we're really excited to be able to offer that extra level of convenience for our patients.
Absolutely. Thank you for that update. Again, talking with Dr. Jennifer Frank, our Chief Medical Officer, and Dr. Mark Cockley, our Chief Clinical Officer, taking your questions. So whatever is on your mind about the COVID-19 vaccine, please type those in our comments here. I'm monitoring them. We'll get to as many as possible. Right now, we're really going through an update about where we are from a system, where we are in the community. Let's go now to one of the questions that we're hearing a little bit about now that the state announced that as of Monday, April 5th, we will expand eligibility to a greater population of those 16 and older. Dr. Frank, do you want to take that, just explain, what that really means? This is open to anybody within that age group. So what happens next?
Yeah, this was actually a point of great celebration in our household last night when we heard the news, because everyone in our household is fortunately healthy enough to not be on a priority list for vaccination, but I have a 17-year-old, an 18-year-old, and then my husband. And we were really excited to hear this because it allows them the opportunity to start getting vaccinated. So I think this reflects a couple of things. One is it's the government's really commitment to increase the vaccine supply. So we're seeing the benefit of that. The second is really increasing the supply of getting the vaccine from the manufacturer to the government out to the healthcare organizations, and then partnering with more pharmacies and others who can provide that vaccination. So I think it really is the reflection of many, many positive changes in our ability to give vaccine. Because not everyone who's eligible is choosing to get vaccinated, that also increases our ability to provide vaccination for everyone. What we've known all along is that our ability to get out of the COVID pandemic is inherently linked to everyone getting vaccinated, or as many people getting vaccinated as possible. So we're really looking for 70, 80, 90% of people to get vaccinated. And that obviously includes our husbands, our children, those kinds of things. So 16 and over is the approved range for the Pfizer vaccination. And that is why the mandate has been expanded to include those patients.
Great, thank you. I'm glad that you brought up the children aspect. We're going to get to that question in just a bit. That is one that is rapidly changing, it seems like, by the day. So glad you brought that up. Again, taking questions and comments here, leave them there, and I will get to them just as quickly as we can and asking Dr. Frank and Dr. Cockley those questions. Dr. Cockley, can you tell us just a little bit about our process at ThedaCare? We were very much focused on vaccinating those 65 and up, those age groups, and then kind of expanding from there. But can you tell us what the reason was behind that?
So some of the initial stages of the pandemic and why you wanted to get the initial groups is, one is, initially was the healthcare workers and the infrastructure workers, the EMS and things like that, because there was a lot of illness going around, and we need to have the hospitals available to provide the care, whether it's due to COVID or not. I mean, we still had, strokes, heart attacks, accidents, injuries, trauma. So we needed that infrastructure to continue functioning to help serve our communities. The next aspect of it is what you want to do is reduce the mortality and the severity of illness and disease. So the highest risk, looking at the numbers as it started, was that 65 and older population that had increased risk of hospitalization, increased risk of death, along with some others. So that was that next phase of that to help reduce that. And now we're in that phase of that. A lot of them have been immunized, especially the ones that wanted to and have the increased risk. There's still some more trickling in as they get more comfortable with the idea of the vaccine. But the next phase is what kind of stepped out are those under 65 that have increased health risk also, because there was an increase in that as far as that group as far as hospitalizations. So that was that initial step. I think it was about 2 weeks ago that came in. Anyone over 16 that had medical conditions that put them at high risk. And now sorting that out to everyone in the population that's eligible based on the studies and safety profiles of the vaccine. And really that gets into the part of the spread of the vaccine, of the virus in the community. Important about getting vaccination is, yes, reducing the spread, but also reducing the incidence of those variants that are popping up. More the virus is active in the community, the more times that virus replicates, it has a chance of mutating and creating a different strain or a different infectivity or a different severity of illness. So the more we get people vaccinated, the more we continue with the things that have been working as far as distancing, masking, and washing your hands, reduce the replication of that virus, reduce the chance of the variants spreading, especially since some of those variants may spread easier. So again, a reason to be more diligent about that, to continue to protect those people who have not been vaccinated yet, those that could then spread it to someone at high risk that has not been vaccinated, to keep businesses open, kids in school, and all those other things that we've been working through in the last 12 plus months, and to get back to normal. So it is very important to get vaccinated and continue everything we've been doing to move through this.
I'm glad you brought that up, Dr. Cockley. We're talking here about our COVID-19 vaccine, but I think something that goes hand in hand with this is testing as well. ThedaCare continues our mobile testing units in rural communities and our site in Neenah Can you tell us why it's so important to continue to get tested? We've seen sort of that decrease in testing over the last couple of weeks, but why is that so important at this time?
Yeah, I'll start off and really it is to identify that illness. I mean, we're still in a time, we've been lucky enough not seeing very much flu in the environment, but we still have other illnesses, other respiratory illnesses. So it is important to know that if you're getting sick and have symptoms that could be consistent with COVID, that you get tested, because that will help you then isolate yourself, prevent that spread to others, allow you to recover safely and reduce COVID in the community. Also, that surveillance aspect lets us know how much COVID is around, how much virus is there, and allow us to make sure we're taking appropriate precautions and know when things may be ramping up, that another surge can be occurring, especially as we get to spring breaks, Easter holiday, a lot more travel as people relax a little bit. We need to be vigilant. Is there something changing in our community?
Good points. Thank you, Dr. Cockley. Again, taking your questions and comments live here. I'm monitoring our chat. Feel free to take this opportunity to ask Dr. Frank and Dr. Cockley the questions that have been top of mind for you. Dr. Frank, I want to get back to something here that we brought up, children and the vaccine. Again, lots of information that just seems to be changing every single day. Can you tell us where we are with the potential for vaccinating children, or maybe some of the studies that are taking place now?
Sure. So the big news is that Pfizer has released their data. It has not been peer reviewed, which is kind of the scientific standard to make sure that the scientific community is agreeing with the conclusions. But they have completed a preliminary study of children ages 12 to 15 with their vaccine, and they have found a 100% efficacy rate. And what that means is during the period of time the children were studied, those who received the vaccine had 0 cases of COVID. And I think there were 8 cases in the group receiving placebo. And both groups had between 1,000 and 2,000 children in each arm. So the group getting a vaccine and the group getting the dummy vaccine. So this is really encouraging news. It does appear that their vaccine response, so the response of their immune system to the vaccine, is as robust as as people who are ages 16 to 25, which is important. It indicates what we thought we would see, which is that the vaccine is equally effective in children as it is in older people. And obviously this expands the group of people we may be able to immunize. It's not yet approved by the Food and Drug Administration, so it's not yet ready. But as we've seen with some of the other vaccines, that approval usually moves through pretty quickly. I do know that Moderna is also looking at the eligibility of vaccine for 12 to 18-year-olds, but I've not seen any of that data come out yet. So really exciting and good news.
You're treating patients and families as a caregiver. Are you having those conversations with families right now? Be prepared, continue watching for those updates. What are you telling those families?
So I'm trying to share with them the data that we know. So what is the current knowledge about how effective the vaccine is, how safe it is, how does it work against the variants, who can get it? And then the other part is the logistics. Who's giving out the vaccine now? How many doses are available? What are the chances that you could get it? And in what time frame? What are the regulations that the state has put in place regarding distributing the vaccination? And really just trying to encourage people that whether they perceive that they're high risk or low risk, the way that we as a community get healthier together is that we are all vaccinated. And so it's almost like the mask. When you wear a mask, you're wearing the mask for yourself, but you're also wearing the mask for the people around you, similar to the vaccine. You get the vaccine both for yourself as well as the people around you. And while we're very fortunate that kids and adolescents are rarely severely affected with COVID, there are cases of both serious illness as well as death related to COVID. And again, one death, one serious illness is one too many, regardless of the age.
Thank you for that. I've heard it's encouraging for those families, right, who are waiting, to see what happens next. We're getting some questions and comments coming in here. Sherry is asking, I understand that Johnson & Johnson is the 1 dose only, which is correct. And we have Pfizer and Moderna, which are 2 doses. Sherry is asking, is it possible to ask for that specific vaccine? And we actually have some new information coming out. Dr. Frank, do you want to just tell us a little bit about that?
Sure. So we're really, again, there's pros and cons of each vaccine. And as Sherry has identified, Johnson & Johnson is a one-shot vaccine, which obviously reduces your risk of side effects by 50% because you're only getting one vaccine. And again, maybe more appealing to some folks. And we are going to be starting, it's not yet, but it will be going live soon, the ability of our patients to select their preferred vaccine if they are able to do so. So for example, there are some age restrictions as we talked about with Pfizer, Moderna, and Johnson & Johnson, but for the vast majority of people, we are going to be able to give them the opportunity to select which type of vaccine they want through our scheduling process.
And Dr. Cockley, can you jump in here about the importance of getting vaccinated when you have the opportunity to do so?
Yeah, thank you, Cassandra. And I think Dr. Frank brings up a couple of great points there. And yes, there will be some ability to get that vaccine or select it, but we still are at the mercy of what's being distributed by the federal government and allocated to the state. So you may say, here I've got a vaccine opportunity at Appleton, and they only have Pfizer. And really, it's important to know that you should get your vaccine as soon as possible, irrespective of the type it is. One is because we don't know that supply chain coming. So if you pass on it now, it could be weeks before again, and you could get COVID. So really, to reduce that COVID in the community, reduce your risks of catching the virus, and reduce that then spreading to others, it is important to get it as quick as possible. And when we talk about you can choose it will be kind of site specific. So since the vaccines are a little bit different, and they come in multi-dose files that we have to use over a short period of time, that a individual vaccine site will likely have one type of vaccine. So because you don't want to go from one type to another type in that same clinic, because there's a risk of wasting vaccine. And that's one thing we don't want to do, because it's a limited resource. We want to make sure we're using it effectively and we're safely delivering it. So some get mixed and some are just out of the vial, some are frozen. So we don't want to complicate things too much. We want to make it safe, efficient. So you may have some chance to say, you know what, in Appleton or in Neenah, I could get the Pfizer vaccine, or I could wait a month to get the Johnson & Johnson. It is better to get the sooner vaccine to keep you healthy, keep your family healthy, and help protect the community as we roll this out.
Great points there. We are getting some really good questions coming in. Joyce is asking about food allergies, and I believe that's connected to people with allergies and getting the vaccine. Dr. Cockley, do you want to tell us a bit about that? Are there any concern with people with allergies and getting this vaccine?
Yeah, for the most part, as far as food and things, there's not a lot of significant issues with the vaccine. There's a couple other things that we do screen for going through, and it's part of the questionnaire in the process. And maybe Dr. Frank, you can kind of hit on that too, through that and what they do. But really, the main thing is if you've had a anaphylactic reaction to a vaccine like this, that's an issue. Also, we do have a process that if you have some food allergies or concerned, that observation period afterwards is a little bit longer to make sure that doesn't occur. And we have then also the supplies and staff ready if you would have an allergic reaction at the site. Dr. Frank, could you give maybe a little more detail?
Sure. Of course. So again, very similar to what Dr. Cockley had just shared, is that we are monitoring people to make sure that they're safe to get the vaccine. And we're really fortunate there are very few absolute contraindications for people getting the vaccine, but there are some precautions. So if you have a history of significant allergies, reactions to previous vaccines, food allergies, that kind of stuff, then we may monitor you for longer. So instead of a 15-minute observation period, we may go up to a 30-minute observation period. At all of our sites, we are prepared to deal with an anaphylactic or an allergic emergency and treat patients right away. So that we are expecting that that's going to happen at least some of the time, although it's been very, very rare. And we are also prepared to treat that. When we ask about allergies, just because we ask the question doesn't mean that it's a problem for you to get the vaccine. It's just a way for us to get more information to understand your risk so that we can make sure we're taking the best care of you possible. There are no food allergies that are absolute contraindications to immunizations, including egg allergies. There are some contraindications. So if you had an allergic reaction to one of the COVID vaccines, that would be something we would want to know about and help you make the best decision. If you have any type of anaphylactic or severe allergy to something called polyethylene glycol, which is an ingredient in the Moderna vaccination, that would be something, again, that you should likely know about and something we would want to make sure that we're aware of so that we can make sure that you're safe. Things like latex allergies, egg allergies, those kinds of things are not contraindications, but again, may alert us to be a little bit more cautious and observe you for a for a longer period of time to make sure that you're safe. Most serious allergic reactions do occur fairly quickly after receiving the vaccine, which is why we have that 15 to 30-minute window.
All right, great information. Thank you for answering that for Joyce. That was a really good question. I have a sort of two-part question here from Jolene. She's asking, why are we recommending the vaccine for people who have already had COVID-19? So Dr. Frank, why don't you take that part of the question, and then I'm going to go to Dr. Cockley for the second part.
Sure, of course. It's a great question. So what we know is that people who have had COVID can rarely become reinfected. And it's also important to know that immunity to an infection doesn't always last for a long time. So you may have it for a period of time and then it kind of fades away. And so we've only had this virus in circulation for a little over a year. So how long immunity lasts is really not clear. It's variable. Some people have longer periods of time where they're immune, and we do know that some people get reinfected. So because of that, we can consider that the immunity following COVID infection, normal infection, is variable, which means it varies from person to person and of an unknown duration. So it's an incomplete immunity. Therefore, people who've had the infection, we want to make sure they still get the vaccination because it offers a more complete and hopefully longer lasting immunity. It is possible to delay the vaccination. So certainly if you still have symptoms, you should wait to get the vaccine. And so we're recommending you're completely clinically recovered before you get it. And if you want, you can delay it for 90 days after your COVID infection. It's not necessary, but you can do that. You could choose to do that either because you're not fully clinically recovered, because it's not convenient for you to get it, or you may make that choice so that other people who may need the vaccine more have access to doing that. Some people have noticed that if they have previously had a COVID infection, the side effects that they get from the vaccination may be a little bit more pronounced, which is not surprising at all. That your immune system is just working very, very well and robust, and sometimes we will see that.
Thank you for touching on that. I think that's a question that we've had before in our Facebook Lives. Again, really great questions coming in. Like I said, Jolene had that two-part question, so I'll get to the second part in just a moment. Again, we're encouraging everybody to ask questions, things that they might be wondering about the vaccine. This is your time with Dr. Cockley and Dr. Frank, things that you might be wondering. So let's touch on that just a bit, Dr. Frank. So is that common, somebody who has had a COVID-19 infection, to have more pronounced side effects? And can you just go into a little bit more why that is?
Sure. So it is, I don't have a specific number. The vaccine side effects are common in general, and then there's obviously degrees of severity. The great news is that the vast majority of side effects are considered mild, and they usually do not last for longer than a day or two. And remember, we're doing this to prevent a disease that can last for, days, weeks, or even months. So the balance of risk and benefit is clearly on the side of vaccination. When you have the COVID infection, your immune system eventually fights off that infection. It makes antibodies, it clears out the viral infection, and you recover from the infection. Those antibodies stick around. And when they see the COVID again, which is really the vaccination replicating what COVID looks like, it's not actually COVID, it just looks like COVID. So your antibodies are fooled into fighting it. And so because those antibodies are already circulating in your system, they will mount a very strong reaction. And that reaction of those antibodies going to the site of where the injection was given, fighting off those invaders, if you will, and then really kicking up your immune system can cause the side effects. And those side effects are the same that you would get even if you hadn't had the infection: a sore arm, fever, sometimes you'll feel a little fatigued, muscle aches, headache, that kind of thing. Again, all of these symptoms typically resolve within a day or two. Some people also notice a more significant reaction after the second vaccine if they're getting a two-part series. And it's for the same reason. Your body's already seen this before, so it already has some antibody memory. When it sees it again, the reaction is more robust. That's actually part of the reason we give a booster, is just to make that response stronger. So in some ways, even though it doesn't feel good, the reassuring part of it is that it tells us that your body is reacting appropriately to the vaccine, so that if it sees it again, i.e. you're exposed to COVID, then it is going to do what it needs to do to clear that infection or prevent you from getting the infection.
I like what you said before, the reference to a couple of days of maybe feeling not so well, sure beats, weeks, months of what those potential impacts could be. So thank you for addressing that. Again, so I want to get to Jolene's second part of her question. This one was for Dr. Cockley. She wants to know why kids are now, the studies are happening for children and getting the vaccine when children have not primarily been getting that ill from the virus. So Dr. Cockley, can you talk about why it's important that these studies are happening now for the potential to vaccinate children in the future?
Yeah, very important. And thanks for the question. Really, we want to get to herd immunity. And to do that, we need to vaccinate a certain percentage of the population. And I think it's somewhere around 25 to 30% of the population is in that age group of under 16. So to help prevent the virus from spreading the community, we need to vaccinate the children. And yes, they haven't typically had bad disease, but to Dr. Frank's point earlier is that, there's still been deaths from COVID in children and significant complications, more so than even in the flu season. So it is important because, the young kids that are 5, 6, 7, you don't want things to happen, especially if they're previously healthy. If you can reduce any of those risks, it's important. And really, and this is really what a lot of things have done medication wise. They're approved in adults, then they modify and adjust it in the children. And this is done with everything and all the vaccines. And children aren't per se just small adults. Their body processes things different. Their immune system reacts differently. Their kidneys filter things out differently, and liver and everything respond differently. So sometimes kids need a smaller dose to get the same response. Sometimes kids need a higher dose to get the same response. So what's that optimal? So we're getting those outcomes that are important. Again, to help produce the spread, kids are in school, they could spread, if they get infected, have very mild symptoms, they could spread it to a teacher or someone else, knowing that vaccines in general are 95 plus effective, which is great with this, but that still leaves a few people that could be exposed and have infection. And yes, it may prevent the spread throughout all the community, but still others could get significantly sick if we don't go through and get the children and youngers immunized. And as that next group is of older, then it'll be, how do we get even the younger kids vaccinated and move through? So it will be to where we're through all of age groups. But again, we want to do it safely, make sure we have the right dosing and the right interval so we produce that long lasting immunity.
Good. Thank you for that. A great question again from Jolene. I have another question for Dr. Cockley here. This one's from Sarah. She's asking, are the variants a big concern at this point? And you've touched just a little bit on that. Can you go a little bit more in depth?
Yeah, the variants, I think individually not a big concern about being there, but it's that process. And really, as the virus goes and mutates, and if it just is a little bit change, our immune system can recognize it and take care of it. And I think that's part of the why, if you've had the COVID and you get immunized, your antibody levels are higher even afterwards. So can produce a better response by your body and for a longer duration time period after infection. So if you get infected, that your body will recognize, take care of it before that virus causes too much injury in the body. That as the variants occur, does it evade the virus change enough that when you get infected, it evades your immune system? So even though you've had COVID before, or even though you've been vaccinated, that virus has changed enough, your body won't recognize it to prevent the infection. And that's the concerning part, that yes, it's inched its way a little bit that way. Some of the variants are a little bit more infective, it can transmit easier, and that's how that virus survives. So those mutations are its way to naturally select to survive and continue going on. So we don't want it to be more infectious. We don't want it to be more severe of an illness. And we don't want it to change so much that our body's tools that are developed from prior infection or for immunization become ineffective. And then we're back into a pandemic again. And that's not where we don't want to get.
All right, thank you for that, Dr. Cockley. Again, really good questions coming in here. Taking questions from all of our followers. Please leave them here in the comments. I'm monitoring live right now, and we'll ask Dr. Cockley and Dr. Frank. Dr. Frank, I have a question here from Tina. She wants to know if the vaccine is safe for someone with an autoimmune disorder, something like Hashimoto's. So can maybe you tell us a little bit about the vaccine safety?
Sure, of course. So one of the things in an ideal state, we would check a vaccine or a medication in every potential combination of people, gender, age, medical conditions, all kinds of circumstances. Because of the desire to get this done quickly, we really tested it primarily in a large age range of adults, but primarily in people who are healthy, who didn't have cancer, who weren't pregnant, breastfeeding, those kinds of things. And so similar to what we do with children, we extrapolate that data. We say, well, based on what we know about other vaccines and about this vaccine and about how it acts in the people we studied it in, is our best sense of how it is going to work? And what we know for people with autoimmune conditions is that they were not specifically studied with the vaccine, meaning the Pfizer and the Moderna, the Johnson & Johnson did not particularly pull out people with autoimmune conditions such as cancer, immune suppressing medications, those kinds of things for kind of the reasons that might be obvious to folks. But they are all not live viruses. So they are all vaccines that do not have any live virus, which means you can't get infected from it. So in general, when you have a not live virus, so an inactivated virus, or in the case of Moderna and Pfizer, it's not even a part of a viral fragment, it's an mRNA, then the chance of that vaccine causing an infection, even if your immune system is reduced, is really just not there. It should not happen. So because of the type of vaccine it is and what we know about other not live virus vaccines, we feel confident that people who have immune conditions can safely receive the vaccine. The reason we have questions about it and the reason we really talk to patients about it is just to make sure that they're fully informed and educated that this vaccine was not specifically studied in that group. That said, unfortunately, millions of Americans have autoimmune or immune suppressing conditions, and they have gotten the vaccine. And the federal government tracks all vaccine reactions. They're both ones that any person can report. You can report it, I can report it, et cetera, as well as when you get the vaccine, you're enrolled, or if you choose to, you're enrolled in a program through the CDC that asks you frequently, how are you feeling? Are you having any symptoms? Things like that. And that allows us to get a tremendous amount of data. So even though it's not a specific scientific study, we are getting data that is helping to inform the safety. And as a result of both what we know scientifically, as well as what we've observed through really hundreds of millions of vaccine doses, we are confident that these are safe medications and safe vaccines for people, even with immune suppressing conditions.
I'm glad you brought that up, Dr. Frank. When you go in to get your vaccine, you do get information about how to report those side effects. So, even if you don't get the side effects, or if you get something mild, can you tell us why it's important to report that? You touched on it there, but what is that really doing for, the future of who is vaccinated?
Absolutely. So the federal government has a program that predates COVID vaccines called the VAERS, the Vaccine Adverse Events Reporting System, and you can actually access it. You can go online, you can pull it up, and all of the information is there. It doesn't have patient-specific information. It just says in general, the 67-year-old person had a rash after vaccine, for example. And that's been in existence for a long time. And the reason is to collect data, to understand, is there something that the scientific studies did not show or demonstrate? Maybe it happens 1 in a million times or 1 in 10 million times. So until we vaccinate that number of people, we won't see it happen. And so we want as much information as we can possibly get. So for example, if you Google information around the human papilloma virus or the HPV vaccine, you'll see that there's a lot out there about people passing out in relation to the HPV vaccine. But if you go back to the VAERS data and actually look at what's happened real time and what's been reported, it does happen, but it happens with about the same frequency as it does for an MMR vaccination or other common childhood vaccinations. So it helps us to put reports in context. How often is it occurring? What were the circumstances and things like that? In addition, the CDC for COVID specifically has an online program. You just basically scan a QR code and you're enrolled. It's completely voluntary, but it is encouraged because, again, it helps us to get as much data as possible, as quickly as possible. And it really will just say, how are you feeling today? And it asks you, I think it asks you every day after you get your vaccine, and then once a week for out to 6 weeks after getting your vaccine. And it's just a check-in. And it really is, again, designed to get as much data as possible, as quickly as possible, so we can learn as we go. And the good news is that the data we've gathered, again, through hundreds of millions of doses, has not altered our understanding of the safety or effectiveness of the vaccine.
Good info to share right there. Thank you. Okay, so again, taking live questions. I'm monitoring the comments. Please take this time, this opportunity with Dr. Frank and Dr. Cockley for them to discuss what you're wondering about the COVID-19 vaccine. We are going to move to something that's vaccine related, the pandemic related, again, because we are sharing the most up-to-date information here. But, recently we have learned that the mask mandate has been overturned. Dr. Cockley, do you want to talk a little bit about the importance of continued masking and why those health recommendations for us are still in place?
Yeah, thank you, Cassandra. It is important because that's what one major thing we've been doing over the last year that has helped. Wearing the mask, prevent that spread. If you're asymptomatic and have COVID, prevent you from spreading it to others. Knowing still in the community and throughout the state, it's 20% of people may be vaccinated. There's still a large number of people who aren't. So really continuing that protection as far as continue to reduce that spread, especially now with maybe some people traveling more, spring's coming around. So when you're in an environment, when you're around people, you're out of your house, it's important to help wear that mask to prevent spread, continue washing your hands. Really that has worked. And one evidence that's worked is that looking at the incidence of influenza and other respiratory viruses this year have been significantly decreased, and they transmit the same way through surfaces, through cough, through contact. So it is important. I think some of the things that the state did, and through that is no one ever plans for a pandemic. So some of the rules and regulations that are set are appropriate for normal times. So I think looking at this pandemic, it's still going on. Even seeing in multiple states the case numbers picking up, I think we still need to be vigilant in Wisconsin, in our area, to wear that mask. It is something that's easy to do. We've been doing well with it. It's been effective to help continue to protect our community as we're rolling out vaccines. I mean, in the future weeks, we could have a significant number of increase in vaccine with more Pfizer, with more Moderna, with more Johnson & Johnson. To wait that a couple extra weeks through April, maybe into May, till we can get 60, 70% of the population vaccinated can really make a big difference versus letting the COVID virus take a hold in the community again and really increase the case numbers.
I like that. The patience theme continues, it seems like. So we'll get to that again in just a moment. Again, sticking with kind of the topics that are related to the vaccine, but not necessarily vaccine. Dr. Frank, holiday weekend coming up, Easter, Passover. Let's just discuss safe behaviors. We've been through, it seems like, a year of holidays now. So where are we at with safe behaviors and what are the recommendations?
So the news is that we have not changed recommendations. The things that were safe for Thanksgiving and Christmas and New Year's are still the same things that we're talking about. And so that is masking. That is making sure that you're maintaining social distancing, washing hands, being aware of whether you're having symptoms of illness or anyone around you is having symptoms of illness. If you are getting together, trying to reduce any exposure. So this is, a good time to be thoughtful about, not singing together, which tends to kind of promote a lot of air exchange, opening windows if possible. We're supposed to have a beautiful weekend this weekend, so it's a great time to open windows and let the fresh air in. Again, just increasing the circulation of air to reduce the likelihood of transmission. It is safest, the safest is to stay with the people you live with or to stay with another person who's vaccinated. If you're vaccinated and they're vaccinated, those are the safest circumstances. For people who are high risk and unvaccinated, we really still do all of the same precautions even if they're around people who are vaccinated, just because we're not 100% certain about what the likelihood is that someone who's vaccinated could still transmit the virus. So we want to keep those people safe. On the CDC website, they have all different types of diagrams about if you're vaccinated and the other person's not vaccinated, how can you mix safely? But in general, if you're vaccinated and the other person is vaccinated, you're able to socialize without masks if you're feeling well. The easiest and safest thing to do is to continue the same infection prevention precautions. We are so close. We are so close to the end of this. And even though we're all kind of tired of it and bored of it and sick of it and all of those kinds of things, we do know that these things are very, very effective. They have really stopped what could have been a much worse scenario and spread. And so we would encourage people as they're getting together this weekend to make sure that they're still doing all the things that are required to stay safe: masking, social distancing, washing hands, doing things outside if at all possible.
Thank you for that, Dr. Frank. We have just a few more minutes here left on our Facebook Live. Again, I'm monitoring the comments. Please take the opportunity to ask those comments, and we will continue monitoring even after the Facebook Live ends. I do have a question from Jolene. She has another question for us. And I think, Dr. Frank, you're sort of touching on this here. People getting the vaccine, it doesn't necessarily stop you from spreading, correct? But it does minimize symptoms. So you may potentially have it, be asymptomatic, and not know that you could spread that to others. Is that correct?
So what we don't know is what is the degree of reduction in carrying the virus. So do you still carry the virus, for example, in your nose? You have no symptoms, you don't have a true infection, but you cough, you sneeze, you talk, you spread it to somebody else. But we know from large population studies, so for example, Israel has done a very good job of immunizing most of its population. So we're able to see what happens when you immunize a lot of people all at one time. And it does seem to suggest that immunization does also reduce the risk of transmitting infection to other people. That's not shocking because we know that people who have more severe infections, more viral load, more viruses kind of kicking around, may be more likely to transmit. But what we don't know is how safe you are. So is it still possible that you have some viral load in your nose, you have no symptoms, you see your mom who's not vaccinated, who may have health conditions and potentially cause that infection? So more study is needed. It does look encouraging, but to be on the safe side, we're still recommending people who are vaccinated take precautions as well.
Okay, perfect. Again, just a few more minutes here. Dr. Cockley, I want to get back to you for a question. This is something that you've been reiterating for the last, year. It's patience. It was patience with, masking. It was patience with where we were with vaccine rollout and getting doses from the state. Again, you touched on it a bit about masking. Can you tell us again just the importance of being patient and what's ahead for the road here?
Yeah, it's been a long haul. When we thought, okay, being patient, it was for 2 months, it was for 4 months, it was 6 months. But really, this is something that is a unique experience that the whole world's been in. Something that I know it's been probably 100 years or more since something like this happened. I don't know. But I think, where we've gotten and how fast the virus has spread, and then with the tools that have been developed in a short period of time using, known technologies and improvement to get us curved in the right direction, producing vaccine that in a matter of months, we're going to vaccinate the whole US population that wants vaccinated. Not once, but probably likely twice for a lot of them. Maybe once if now we've got more and more Johnson & Johnson, but it just, looking back at what you've been through, it's like you don't want to throw it all away now. It's like, okay, you're finishing your college degree and you've got a 4.0 average, so you're not going to do anything in the last quarter and you're going to blow it. You don't want to do that. You don't want to get to the end of the game with a minute to go and you've got to lead by 5 and you blow it and now you've lost. So I think that's how you to this and say, you know what, we have a little bit of time. It's weeks. It's not months. It's weeks that to get more vaccine, to get more people vaccinated, to continue to wearing the mask, to prevent the spread. So we can enjoy the summer and late summer, enjoy the graduations in June, July, and August, kids going back off to college and those type of things, football season in the fall, all that we want to enjoy that we've missed, that it's worth doing the next couple of weeks with the masking, doing the hand washing till we have, like Dr. Frank's, the data that says, yes, you are safe. Yes, you're not going to spread it after you've had that second dose. Is it that, and I know in a couple of areas they're doing research on a booster shot. Will the booster shot that has some of the variant things in it be the key that, hey, now opens things up more? So more to come. We've learned a lot. We've done a lot of great things to protect our community, reduce the mortality, reduce hospitalization, reduce illness. So, I think just keep up with it and be patient. We've gone so far, we don't want to lose now.
Absolutely. Again, a couple more questions coming in here. I have one from Christine. Dr. Frank, do you want to address this? How do you convince loved ones to get vaccinated? I think this is a really important question for us to talk about.
Well, I think the first is that you don't. It is impossible to convince anyone to do anything that they don't want to. And interestingly, there's been a lot of research done on vaccine refusal. So people who refuse to get a vaccine and what works and what doesn't work. And what does not work is arguing with them about getting the vaccine. So I would encourage people to share facts. This is why I got the vaccine, to abide by CDC recommendations. So for example, that might be saying, hey, we'd love to get together for Easter, but because you've chosen not to get the vaccine, I don't feel safe sharing a meal. So we're not going to be able to do that until you choose to get a vaccine. And then I think, again, sharing your perspective, that actually is a very powerful way to help people feel better about getting the vaccine. So, part of it is that if you look on Facebook or social media, or sometimes even in a crowd of people, the people who are very vocal don't necessarily represent the majority, but they are very vocal. And so it can seem like with a silent majority that the minority is actually the majority. So I would encourage people to on your Facebook or Instagram or Twitter, post, hey, I got the vaccine. I did great. No problems. Or there's a lot on the CDC that you can actually just borrow from them and post that has facts about the vaccine. There's myths out there. There's Mythbusters. So the CDC also has those Mythbusters. There's some very classic myths about vaccines that are not unique to COVID. These are actually the arguments against pretty much all vaccines. It was rushed to production. It's not safe. It's not effective. It uses fetal tissue. It's unproven. Take your pick. So I think being armed with facts, but also just being respectful that when people feel very, very strongly about not getting a vaccine, it is difficult to convince them otherwise. And I wouldn't strain your relationship by making it about that, recognizing it's still a personal choice. As a doctor, for example, I share my best medical advice, and then I share personally what I've decided to do for myself and my family. But again, at the end of the day, people have to make the choice that they're going to make for themselves. I think where the emotion comes in some cases is we recognize as a community that other people's choices to not get vaccinated, to not use a mask, those kinds of things do impact all of our health, do impact all of our ability to get back to life as normal. And so it does feel very emotional and personal, but I would encourage you just to share facts, share your experience, but still love those people, whether they choose to get vaccinated or not.
I'm glad you brought up the CDC website. There are some very good resources on there that kind of take the guesswork out of what to say to have your own encouragement out there. So good resources on it. Thank you for that. So I asked Dr. Cockley about patients throughout this pandemic. Dr. Frank, I think our last question here, because we're coming to the end of the hour, what has maybe surprised you or stood out to you, or what's been the proudest moment for you to witness from a community perspective throughout this last year?
I guess I'm going to answer that in two parts. From a local community, I'm not surprised, but I'm very impressed by how we have worked to help each other. That there's just so many examples. It's hard to identify them all, but everything from what United Way has done, how healthcare organizations have worked together, how public health has stepped up, how I think even though we don't always agree with decisions that each other might make, I think they've all been made with really the best intentions and the desire to be safe and to keep people safe. I think our school systems have done an amazing job in keeping our kids safe, but also balancing their need for education. So I'm just very, very impressed with how we have responded. Sometimes it's easy to see the deficiencies, but to put it in the context of a totally new pandemic that has affected us all so profoundly. It's pretty amazing what we've done. On a more global community level, I am so impressed that we have a safe and effective vaccine. This is a fantastic vaccine, just without it being related to COVID or anything, just it's statistically how effective and safe it is, how well it works, is just puts it on par with some of the best vaccines we have. So I am just very pleasantly surprised that it happened so quickly. It happened very collaboratively. And truthfully, we're, a year into this and we have so many people vaccinated. And next week, anyone who's 16 and over who wants to get vaccinated in Wisconsin can. That's a tremendous accomplishment, a lot to be proud of.
Thank you for that, Dr. Frank. All right, Dr. Cockley, we're going to wrap up with you here. Final words of wisdom for our community members watching.
I think, obviously hold steady with the course of the masking, wearing hand washing and distancing, being careful and vigilant, like Dr. Frank was saying about the holiday coming up, and really look at what's your personal risk. Also, we're talking about people who have immune compromised or other risk factors that, yes, there may be still some things unknown about the vaccine because it's newer and we're still collecting data, and those post-marketing research or post-introduction research is really helping out. But we know there's still a lot of virus in the community, and what is your risk of infection and the downsides of that? And really have that in mind when you're considering whether you get vaccinated or not, and then have your discussion with your personal health provider and getting their input. As Dr. Frank says, she gives the advice medically what's there, personally what's there, and what is your individual risk. Having that open dialogue will help you get to that decision that you can be comfortable with, whether it's I'm going to get the vaccine or not, but you'll know everything you need to know to protect you and to protect others. So those are the keys. Hold the course, be patient, and we'll get there and we'll have a great summer. Thanks.
Wonderful. All right. Thank you both so much. Again, thank you to all the people who asked comments and posted their questions. Again, thank you so much.
Thanks.